Welcome, everyone, and thank you for tuning in. We're continuing our bi-weekly COVID-19 updates, as well as continuing to include details and voices on community issues that have been made worse by the pandemic. Today, we're going to focus on issues around unemployment in our workforce. COVID-19 has caused upheavals for so many businesses and organizations that were forced to close, slowly reopen, and adapt to a new normal they were presented with. Distancing, masks, limited occupancy, and thorough cleaning are just a few of the changes that businesses have been faced with, and employees have been asked to approach their work with a new caution and uncertainty. Early on in the pandemic, the federal government responded with initiatives like the Pandemic Unemployment Assistance Program, the Paycheck Protection Program, and stimulus checks to Americans. But lately, we've seen some of those programs wind down and leave people who were impacted with less supports than they had earlier on. Today, we're joined with Natalie Bernosky, and the Executive Director of the County Workforce Development Board, and Jackie Muyesu, Director of the Tompkins County Office of Employment and Training, and the Workforce Development Coordinator for Tompkins Workforce New York. It's a mouthful, Jackie, all of that together, who are joining us to talk more about workforce employment in Tompkins County as it relates to COVID-19 and what we're seeing now. We're also joined by Public Health Director Frank Krupa, who will provide updates on COVID-19 spread in our community and its direct impact and indirect impacts on the public's health. Natalie and Jackie, why don't we kick it off with you, allowing you both an opportunity to introduce yourselves and share with us what you do and what your services your departments are providing within our community.
Sure. Well, I'm happy to start. Thanks, Amy. I'm Natalie Bernosky. I'm the Executive Director of the Tompkins County Workforce Development Board. And we are a combination of county businesses, social enterprises, nonprofits, and service agencies that all work together to strategically plan the labor market in the county. So we tend to use federal and state money to invest in the workforce, and that means a whole series of programs, training opportunities, apprenticeships, and we work very closely with the Career Center, Tompkins Workforce New York, which is Jackie.
Hi, I'm Jackie Muyesu. I'm the Interim Director of the Office of Employment and Training and also the Career Center Manager for the Tompkins Workforce New York Career Center. And essentially our career centers, there are career centers all across New York State as well as all across the country, serving every county across the country. And the intention is to provide support to job seekers who are seeking employment and trying to help prepare themselves for employment, increase their employability in the local labor market. And this year we find ourselves particularly assisting people with navigating the unemployment insurance benefits process. We have staff in the Career Center that are working both for New York State Department of Labor and then also Tompkins County staff who assist people both with the unemployment process as well as the reemployment process. We also provide additional supports to businesses, helping them to find viable candidates for their open positions. And we'll talk a little bit more in detail about that further down the line.
Well, thank you both, Natalie and Jackie, for joining us. I'm going to turn over to Frank. And Frank, I'm going to ask for updates on the disease. We have seen an uptick in cases recently and have announced a few clusters related to Cornell and TC3. Can you share how the return of the colleges has been going and how the new cases are starting to impact the community?
Thanks, Amy. Yeah, we've seen an uptick in cases, and we have talked about a couple of clusters that we've identified. I think the good news is that within those clusters, the case numbers are growing, but growing as mandatory quarantine individuals turn positive. So the good news in that is that they're already in quarantine and are not out creating additional exposures. So while the numbers may continue to go up related to those clusters, we're not seeing additional exposures that would, demonstrate this is uncontained. So that's really important to point out. And it's really a testament to the nurses and the team here at Public Health and their work doing isolation and quarantine through case investigations and contact tracing, as well as our partners at Cornell and Cornell Health in particular, who have been doing amazing work supporting students that find themselves either needing to be isolated or quarantined. So yes, we've seen the numbers go up. But it's something that we thought we might see, particularly because students often live together. So if you have an exposure and someone tests positive, their housemates can then potentially get positive, and you can see numbers increase from those scenarios. Really what we're asking, as we've always been asking, is to continue to wear masks and socially distance. In a lot of these instances, we've seen small gatherings, folks of 6, 8, 10 people getting together, as you would expect, and as is okay to do, but they weren't wearing masks or keeping 6 feet apart. And so as we've known all along, if you're not doing those things, we're going to see disease transmission. And that's really what we've been seeing so far. But I think in general, things are going well. Our reentry testing that Cornell conducted showed relatively low numbers, below even the most optimistic modeling that was done. And the recurring surveillance testing that's been going on for the last week or so, again, are showing prevalence rates below even the optimistic levels in the modeling. So if we can really control these clusters, change our behaviors around those small gatherings, we have a chance of really seeing those incident rates continue to stay low.
Thanks, Frank. I have a few more questions for you, and then Natalie and Jackie, of course, I have some for you. And then if anyone wants to provide additional questions, they can do that through the chat box on YouTube. So Frank, back to you. How has the opening up of access to testing and CHS impacted our local testing? Are we still seeing asymptomatic individuals in our testing results?
We are. We are still seeing asymptomatic individuals, so it is important that we do have the surveillance testing both in higher ed and in our larger community. We haven't seen a large increase in numbers in testing, at least over the last week or so at the drive-through site, but we didn't really expect that we would. This new availability was about maintaining testing beyond the medically necessary tests for those that are positive close contacts or preoperative. It really was about workers, essential workers, phased workers, protesters, the general public having access to testing if they wanted it. So we're very excited that the legislature has presented that opportunity for us here in the community, and it will help us prevent the spread by finding those asymptomatic people. And a bit of news for those that may have driven by the mall and seen notice that the tents are no longer there out front. Testing is still going on. It's just been moved to the rear of the mall. So if you pull into the mall entrance, you'll see signs directing you to go around to the back of the mall, and you'll see those big white tents that we're used to seeing out front. They've just been relocated.
All right, thank you for that. We've also been hearing and seeing reminders about the upcoming flu season. Can you share why getting vaccinated against the flu is even more important this year?
Absolutely. Getting vaccinated for the flu is the #1 way to prevent getting the flu. And so we encourage that every year, but it'll be even more important this year. Not necessarily because we're expecting a more significant flu season. Actually, because we're asking people to wear masks, wash their hands more frequently, socially distance, we might actually see a less significant flu season because those things are all going to help us with flu. Why it's important to still get vaccinated and be concerned about flu is the symptoms are very similar. And so we're going to be treating those symptoms with COVID reactions until we can prove it otherwise. So it's really important that we get our flu shots, that we try to avoid getting the flu, so we're not unnecessarily isolating and quarantining folks. And really, we want to keep people healthy. And you know, independent of COVID, flu is not something we want to be messing around with either. People get very sick and unfortunately die from the flu as well. So we're really going to be encouraging vaccinations and continuing to follow that COVID guidance.
Are vaccinations available locally, and should people get them now or should they wait until later in the season? When
Yeah,
is the best time?
Sure, vaccines are available. You can talk to your primary care provider. Most of the local pharmacies will have it available for you. And now is the time. We want folks to start getting their vaccinations. Certainly by mid-October, end of October, you want to have gotten that vaccine so you're ready for prime flu season. But again, with the symptomology being similar to COVID, the sooner you can get that flu vaccine, the better off it's going to be for you and protecting yourself, and hopefully not having symptoms confused with COVID.
Great. Thank you, Frank. I'll give you a little rest and shift over to our guests tonight. Natalie, this one's for you. What was the peak of unemployment rates locally during COVID-19? And where do we stand today?
Well, let's see. We can give you some numbers of what today looks like compared to about a year ago. The really interesting thing about our labor market stats is that so much has been happening so quickly that our statistics are about 6 weeks behind. And that's every month. And so when the Bureau of Labor Statistics nationally releases numbers and the state releases numbers, the picture that we're seeing is actually about 6 weeks old compared to the moment we're in. So at the moment, the latest numbers that we have as of the end of July 2020 are that the unemployment rate for New York State is about 15.5%. Now, here in the county, we tend to look at something called the Ithaca Metropolitan Statistical Area. And that pretty much covers Tompkins County. This time last year, the unemployment rate for that local area was 3.9%. Today, or again, as of July 2020, we're at 9.9%. That's quite a big difference compared to 12 months ago. And so we really are keeping an eye on that number. And I'm sure like throughout the rest of our time together, we're going to be talking a lot about what we're doing on that.
So on that, are we seeing a flattening of the curve in unemployment insurance claims then?
We are. We're starting to see that number come down, which is really encouraging. So from the beginning of the executive orders, which encouraged an increasing number of the workforce to stay home in mid-March, we've seen an immediate impact on the workforce development system and obviously on the claiming of initial unemployment insurance claims. One of our highest weeks saw about 1,400 people claiming. And that really was our peak. And that was at the end of April and the beginning of May. That's when everyone was getting their notices about furloughs. That's when employers of all kinds were making decisions about layoffs. And I'm really, really happy to report that today, although we are still seeing initial unemployment insurance claims that are higher than last year, we're now only seeing about 100, 125 a week. That's really, really good news for our labor market, for our overall jobs market. So can we say a flattening of the curve? I think we're thinking more in terms of a very wobbly line. And the reason why is because there are still a lot of unanswered questions. Some of the things that Frank has mentioned are affecting us as parents, as students, as businesses, as nonprofits, as employers, and as service providers. And so there is still a little bit of upheaval in our jobs market, but we're getting better.
Great. So no more flattening, more of a wobbly line. I've got it. Okay. Here's another question about the $600 pandemic unemployment assistance. Did the end of that in July make us see more people seeking employment? Did that create a shift?
We don't have the numbers that show us that yet. On that $600 additional top up to unemployment insurance claims, I have to say that, all of the workforce system and all of us as county partners supported those payments. We wanted to see that money get to people at a time when the loss of employment was completely unexpected for both businesses and for workers. I think one of the things that we really are starting to see now that that $600 has concluded is that that's a lot of money that is now not in our local economy. And what that can mean is, we are all interrelated here. So that loss of that money might mean that a family is less likely on a Friday night to order curbside pickup. And if that happens, that means that a restaurant may be less likely to need a crew of 5 and may only need a crew of 3. And so the disappearance of that money does have an impact, and we're trying to watch that really closely at this time as well.
Thank you. This question is actually for both Natalie and Jackie, and it's more about our places hiring right now. And how are you encouraging Tompkins County residents to find a job if they're unemployed due to COVID-19 or they're entering the workforce at this time?
Sure. I'm glad to jump in with this one, and I'm sure Natalie will join me. So we are seeing a lot of employment postings right now, and one of our staff members is actually facilitating something that we call a jobs board, or the Tompkins Redirect website, which Dominic, if you would help us with posting that in the chat for us, that would be wonderful so people can access that. So we're seeing employment really across all industries, office positions, retail, manufacturing, healthcare, education. We're really not seeing any specific industries that we're not seeing job posts in right now. And that's anything from entry-level positions that may not require significant education or experience, through mid-level as well as advanced level positions that may require more experience and advanced training. We're also seeing jobs that are full-time and have benefits. We're seeing part-time positions. We're also seeing a lot of remote work options for people at this time, as well as jobs that are noting that they offer flexible schedules. So we find that really encouraging. Do you have other things to add, Natalie?
Well, I would say that yes, while there are job opportunities available, that the rate of offering positions is not as high as we have been able to see in years previous. And so that may be an indicator that job creation is not happening as quickly as we'd hope. What I would say is that just like Jackie mentioned, there are positions, all throughout, admin positions, delivery services, healthcare, and yes, a lot of new opportunities that can be done from home or remotely. If you're a business listening to this call or tuning in, we did want to make sure that you knew about the Shared Work program. Shared Work is a program that's offered federally and through New York State that enables you as an employer to split shifts or offer alternative days for your employees, and for their lost hours, they are eligible to make an unemployment insurance claim. This was a program that was really emphasized when we were at the peak of unemployment and is now being repurposed and viewed as a reemployment plan. So if that helps businesses and other kinds of employers in our local economy, if that idea sounds appealing to you, please reach out. If you're a current employee and you're having conversations with the HR department or someone else at your place of employment, you might want to mention the Shared Work program. Now is very much a time, as Jackie and I talk about every day, now is very much a time where you can negotiate a work from home scenario or a reduced hours scenario if that's what you're interested in. And if that helps you to balance all of the challenges that we're experiencing now in work and life. So do please reach out to us about that.
As we talk about, the differences in the sectors, I would like to know, are there sectors that are actually growing amidst the pandemic? Are we seeing growth in any areas?
I think that's a great question. I think one of the things that we're most definitely noting is are the types of employment then that can be done remotely. So people who have skill sets that allow them to work remotely, they have computer and technology experience and expertise, that those skills are particularly being sought right now for certain. We do know that information technology jobs are plentiful, and that those particular skill sets are being sought for sure. I think it certainly increases people's employability the more they can learn on that front. So rather than feel discouraged if you don't feel like you have particular skill sets in technology or computer use, internet, and so forth, I would encourage people to try to do some training. There are many free trainings available at this time, and this is also something that Tompkins Workforce can assist people with navigating to help increase your employability for those types of jobs.
And so, Jackie, if someone were interested in building their skills, they could come to the work or reach out to you via the chat.
They can reach out to Tompkins Workforce New York via our phone line and via email as well. Those are, you can access those via our website as far as how to make contact with our staff and how to make contact with our office. And we can help people navigate both accessing online training as well as potentially accessing assistance with other types of training that people may be eligible for.
Great, thank you.
Sure.
On this next question, I'm actually going to turn it, start with Jackie and Natalie, but Frank, be prepared. I have a follow-up for you. What are the changes to work as a direct result of COVID-19? As far as like safety measures, you've talked a little bit about remote work, but what changes are you guys seeing in the way that we do work?
Yeah. As we all know, work has changed quite dramatically. So for people who are going into workplace settings, they are dealing with everything from an initial health screening, which may take place at home before they even come to the office. For others, they have to take that health screening immediately upon arriving at the office, answering a series of questions. In some cases, people are also, checking their temperature as they're signing in and going through a protocol, a process at the beginning or at the start of their day. In addition to that, people are also dealing with workplaces that are small and confined spaces, and so there may be limits to the number of staff who can be in any workplace setting at any given time. They're certainly having to navigate social distancing, wearing masks in the workplace. People who may be working from home are also navigating, a whole range of different things that they might juggle in your home workplace. So it could be handling their own childcare, children who are at home and are not able to be in a daycare setting. Even school-age children, we're now, getting ready to launch into the start of education, or many of our schools have already started, whether that's virtually or some hybrid models of in-person and virtual education, and that's posing real challenges to parents who are employed people. We're finding that parents are juggling, being full-time parents, being full-time caregivers, and being full-time educators even, and trying to help their school-age children navigate those things while they're also being present on Zoom meetings and having a full course load themselves. So many different challenges. I think other things too, just thinking about remote work are, and I've dealt with this challenge myself, are internet bandwidth issues while my children, are dealing with college education remotely and high school education remotely, and I'm trying to deal with my own Zoom meetings. So not just, with younger or school age children, but even navigating other challenges with any number of people in the household.
And so I'll turn it over to Frank now. And Frank, what does the health department do to ensure a healthy workplace for your employees?
Wow, great question. We've been doing things for quite some time. Our employees are all wearing masks. We have social distancing requirements in the building. We're no longer doing in-person briefings, even though people are in the building, we're doing them via Zoom. So we're not gathering large numbers together. Our front doors have been locked for several months now. We have an intercom with a video system at the door. So if any participants or clients come to our building, they can ring our doorbell and our front desk staff will greet them and walk them through any processes if they need to access services in the building. So yeah, we have a lot of protections in place for our folks, and we have a lot of folks working remotely. I think that's been one of the biggest learnings. You've heard Jackie and Natalie both talking about, as we don't turn the lights off as a COVID thing, but we have a lot of folks that are working from home, right? And before this, we were kind of slow walking towards work from home as something we were, evaluating, but we kind of ripped the Band-Aid off and we realized we can do this, right? And in some instances, it's even a better access point for services for some of our clients and participants. It takes away some of those barriers of transportation and others. But we also recognize there are folks that still need face-to-face service, and we're working towards trying to put safety protocols in place to be able to do that as well.
And Frank, as both the public health director as well as the mental health, are things similar in the mental health building as what you're doing in public health? Have things shifted there in that workspace at all?
Yes, yeah, it's definitely shifted. The main difference is the doors were never locked in mental health. So we are a safety net provider and a provider of crisis services. So we wanted to make sure that our doors were always open to those that needed us. And they have remained that way. We put safety protocols in place. All of our in-person services are done on the main floor of our building. And we even do telemedicine when somebody comes to the building. We have a station set up there on the first floor, and our therapists upstairs can provide telemedicine at a distance so that there's safety. For those folks that need medications that might be injectable, obviously we have to do that face-to-face, and we've got safety protocols and PPE for our nurses to be able to do that well. But we have definitely transitioned to telemedicine. And again, we've seen it really works for some people. And then for others, we've got to figure out ways to get back to some sort of face-to-face service, because obviously, as we know, not everybody reacts to the different environments the same way.
And so as far as services, I'm going to turn it back over to Jackie to talk about the Workforce New York Career Center and what services you do provide and how members can access those services.
Sure. Great question. So at this time, the Tompkins Workforce New York Career Center is closed to the public. That is a decision that's made by New York State Department of Labor at this time. However, we are fully staffed and providing services remotely for members of the public. So that, again, could be whether, that's job seekers or employers. And we have been assisting people all throughout the pandemic while the doors have been closed. So anyone can receive Career Center services. It doesn't matter whether you're currently going through the unemployment insurance benefits process, or even if you're fully employed. We are even hearing from people who are fully employed whose circumstances may have changed as a result of the pandemic, and even as a result of decisions made by local school districts, such that they may not be able to do the work that they previously had done, and they're looking for other types of work. And so we welcome you and want to assist you with your search. So general services that we provide: job search assistance, labor market information, finding out what kinds of jobs are actually available, career exploration. So in some cases, again, people may have different skill sets than what are being sought right now, and we can assist you with finding out what kinds of jobs are available, and if there is any type of training that might help increase your employability for those jobs. We assist people with interview preparation, resume writing, cover letter preparation. Again, as far as training is concerned, that service, as far as people being eligible for training assistance, we can provide information about training, but if you're actually looking for funding assistance for training, you do either need to be unemployed at this time, or you would need to be a recipient of TANF services. And we can walk people through that process. So in those cases, people may be eligible for training funding that can help pay for the cost of tuition, books, required supplies and equipment, even fees that people might have to pay for becoming recertified or relicensed for different types of jobs. And as well as transportation expenses, if a particular training might require you to drive to and from school or clinical experiences, our funding can even assist with those costs. So what I want to explain as far as training funding and accessing that, your best route is to either call our phone or email. And again, those bits of contact are in our website, and let someone know that you're interested in talking with a staff member, and we can guide you through that process. As far as immediately accessing training money, for example, if a training starts next week, we do not at this time have the infrastructure in place to move things that quickly. We are navigating right now all of the things that we're all challenged by, as far as making paperwork accessible, applications accessible, registrations accessible online. And just in a virtual capacity. What we're trying to ensure is that any member of the public, whether you have internet access or you don't have internet access, and you are only able to reach us by phone, we want to make sure that everyone has as equal access as possible. And so we are redeveloping our infrastructure right now. We are taking a waiting list of people who are interested in training. Our staff can assist you in the early stages of researching and determining what training you may need or what training you may want. And there's a lot of legwork that can be done, between our staff and the job seeker before we would even have to navigate the paperwork process. So that's what we're trying to do, is help people get connected with the early stages of the process. And then while we're developing or redeveloping our infrastructure, be ready to assist people when they're ready as well. We also have virtual workshops every week. We have a calendar on our website, so we would encourage people to tap into that, see what kinds of workshops are available. And then lastly, we're also assisting employers with job posting and searches for their candidates as well. And I'm sure I'm bound to have left some things out, so feel free to jump in too, Natalie, and glad to answer other questions.
Well, Jackie and I talk and text and communicate in many ways several times a day. And so she and I both feel very dedicated to an inclusive agenda and access to employment and benefits and training. And so, I'm just going to take your cue, Jackie, and say that, in terms of looking forward and the future of our economy and the jobs market, we here at the Workforce Development Board are working with a lot of community partners to plan 2021. And, some of our key principles, organizing principles, are the race, equity, and justice agenda, really trying to reconsider the green economy and green jobs and how we can incorporate that into a number of different industries. And also, as we've been talking about here, a very new understanding of working from home. And that's in terms of serving employees and businesses. So watch this space. There's much more on the way.
And Natalie, a question that I have too is, as we start to talk about it, often you hear people saying the new normal, or when we get back, when, post-COVID, when everything returns to normal. And I see both you and Jackie making faces. What are your thoughts about the workforce when we get back, or in the new normal, or whatever that may be?
Yeah, thank you for asking. And this question arises probably 5 or 6 times a day in a variety of different Zoom calls, either at the national level or with regional planners, with our economic development team here at TCAD, and amongst ourselves as a workforce system, and with businesses throughout the county and beyond. I have to say there are two schools of thought, and just as you have outlined, Amy, one is, when we get back to the economy we had in January, and the other is, no, we are in a new world. And I think we in the workforce system are very much looking toward that new space. We feel that the economy has changed so dramatically. And I think that we're lucky here in Tompkins County because we're nimble and we will adjust. And we can see our jobs market starting to do that anyway. So we're looking forward to new industries, new requests in terms of the skills that our employers want now, as opposed to back then. And like I said, setting ourselves some targets for achievement on how we can improve our labor market. That's where our focus is.
Great, thank you. I'm going to totally change the topic, and I see Frank has woken up. His lights came back on. So Frank, this question is more about our cases. And when does the health department define cases as a cluster?
Yeah, we did that for the first time. I guess it was a week ago now. So generally speaking, a cluster is 3 or more cases that are outside of a household, right? So if mom, dad, son, and daughter all come positive, we don't call that a cluster. If dad and daughter become positive and another child and their parent are positive from a different home, but their connecting point was a play date, and that was really the only other option for exposure, then that would be potentially be a cluster. We look really closely when we have large numbers, right? Because we want to make sure, again, we're going back to that containment conversation, that if we have a situation where things are outside of what we would call normal exposure or expected prolonged exposure in a household, that we understand that and we have our arms around all of the contacts and are quarantining the appropriate individuals. So generally speaking, 3 or more cases that are not within the same household.
All right, thank you, Frank. Yes, that seems to be a new word. We've learned quarantine, isolation, and now we're moving on to clusters. So thank you for that. This is actually my final question, and this one is for all of you. What barriers are present in our community as people start to look for work or are seeking work? And Frank, I also asked this for you, as an employer, what barriers are you hearing about as your employees are working 7 days a week right now at the health department to ensure that we have the safety and are being supported throughout the pandemic? So what barriers are there? And if you have solutions or ideas of solutions, I would ask that you offer them as well, because I feel childcare and other topics that have been touched on are probably some of those barriers. So I don't know who wants to start us off, but I will let you choose. Oh, Jackie's going for it.
Sure, yeah, I'll jump in. I would say I would really just reiterate some of the things that we did talk about that are part of our new norm. I think they can be barriers for people. So navigating childcare and school age education for folks, parents kind of having that dual or even three tiered role of being full-time caregivers, educators, and employees, trying to meet the needs and the demands of their own workplaces. Again, I think I mentioned before that we are seeing some individuals who may not have skill sets that are conducive to the workplaces that they previously worked. And that is often exacerbated by their need to be home, at least in part, managing, child education and daycare and so forth. And I think the challenge with that is that if they don't have the skill sets that they need or the skill sets that are being sought right now, the added challenge is carving out time to then work on retraining so that they can be employable in the labor market. And then also certainly access to technology, internet, and some of those things that are not accessible across across every population, and even rural versus city and so forth. There's challenges for certain on that front, I think.
So Natalie or Frank, do you have additional challenges or solutions?
Jackie has mentioned a few times now this dynamic where, we're in a moment where we're expecting people in many cases to be full-time caregivers and full-time employees. And that's a very new labor market. And so I think that we are all going to be searching for language about how we negotiate that new reality with businesses, either with our current workplaces, if we have or haven't been called back yet, or if we focus on a new kind of job we'd like to have and we get to the interview stage. When do you start that negotiation? Can you ask if this 40-hour-a-week job could be made into 30, and can I do 20 hours at home? Conversations like that. And I think that, again, in communication with Jackie, that we're going to have to provide some tools to the community about how we have those conversations. Another thing that we've been thinking about a lot here at the Workforce Development Board is how do we help businesses who do and do not have HR departments make some changes in terms of race and equity and justice? Are we thinking as creatively as we might about how we look for talent, how we seek the perfect person for the job opportunity we're offering? And so those are some of the things that we're working through at the moment, and we hope to have some answers in a few short weeks. So we're getting there.
All right. Frank, anything to add in?
Yeah, I think we've had a couple of issues. I think the first one that probably everybody dealt with was fear, right? Trying to navigate through fear and valid fear that folks didn't know whether their workplace was safe, and communicating effectively about the steps that we're taking and how we keep the lights on. My apologies. The steps that we're taking to keep them safe, and the realities of how the disease works. So we've had a lot of conversations and communication about that as things have evolved over the last few months. And then I think one of the bigger challenges for us is some of the protections and new workforce rules exempt essential workers, right, for certain things like leave protections and others. And for law enforcement, firemen and women, dispatchers, they're kind of used to being essential workers and know how that works and kind of how that lifestyle is. For our public health folks, we've certainly talked about it, and it is in our planning that we would be available, and obviously we have responded, but as we're trying to navigate these new protections and the exemptions that exist for essential employees, it's different for us. We're not used to that, and so we've had a lot of conversations, and we want to be fair to the people that have been working nonstop for 7 months, so that they can take care of themselves and their families, particularly as school starts up and the potential exists for children that have symptoms that can't be in school. How do we allow them to either work remotely or have the time available to care for those children? So all of those things, we're working through. I don't know if there's any great answers. I think, being human about it, understanding everyone's situation is different, and that we have to look at it from a case-by-case basis, and just trying to be as equitable as possible in the administration of all of these new rules.
Yeah. All right. Well, thank you all for your time tonight and for, all the work that you are doing. I think you hit on it, Frank, and we've talked about certain words that have come with this year that we continue to use but don't like, things like uncertainty or things are evolving. And I think, unfortunately, they really describe what we're going through as we look at our economy and how COVID-19 and the pandemic really has rippled through all parts of our lives. And so we appreciate all the work that you guys are doing and the rest of the teams throughout the organization to really take this on and support our community as best as we can. So thank you for sharing with us tonight. And we'll be back again, I think, in 2 weeks. Thank you.
Thanks for